Hey everyone. Today I'm going to do a quick video on two of my favorite Ayurvedic herbal formulations for the lungs. They're not only delicious, but they're super effective for a lot of common cold viruses. I've used them with great effect during COVID for people who are struggling with, especially during the Delta variants when people got deep bronchial congestion, but also in this new Omicron variant where it's tending to really hit the sinuses but drop down a little bit deeper in the chest than the first Omicron variant. Um, so these two formulas are known as Sitopaladi and Talisadi. They're both really similar in their properties and indications, and there's some differences to them, and I'd like to just suss that out a little bit and help especially new practitioners to kind of determine which one's going to be better than the other for a given condition. I'm going to try to keep it really simple. Both Sitopaladi and Talisadi have similar ingredients, and one of which is Bansalochana or bamboo mana. It's a pithy, silica-rich eye of bamboo that's harvested out of that inner core of the bamboo. It's cooling, it's astringent and sweet. It pacifies pitta and kapha primarily, and when added with the sugar that's actually in the formula, it soothes the dryness of it a little bit. And when other substances, especially like a honey anupana or a honey media, is added to it, it can further soothe the throat and not create excessive dryness. But it's a wonderful substance, and it serves in these formulas to decrease inflammation in the lungs, and actually to support and build and tonify the respiratory immunity and just give good support to the lungs, especially during the acute phases of illness, but also in the convalescent phases of illness when a person's kind of trying to build back up again. Sitopaladi has pipali, cinnamon, cardamom, sugar, and Bansalochana. This formula I like more when there is yellow to green mucus and a risk of or active upper respiratory infection. And so the more heat involved, the more Sitopaladi I'll go for. If the phlegm is thick and maybe yellow but white or clear, and there's just a lot of deep congestion and sinus congestion, Talisadi is great. So it's going to be a lot hotter because it has Talisa added, it has black pepper added, it's going to be much spicier on the tongue, and both of these formulas can be used when there's an active infection. I just want to be clear with that. But I will tend towards Sitopaladi the more heat that I see. If I'm treating somebody who already has a propensity for a pitta aggravation, and I know that they have a lot of heat expression, if they have the flu, for instance, and they have a high fever, and there's a lot, maybe cold sores or real burning sore throat, and Sitopaladi might be my herb of choice. Whereas, if a person has more kapha qualities and they're more just a lot of dampness there, then I will add a little extra heat with the Talisadi. If there's a combination of doshic expression going on, there's no harm in using either one. You just want to combine them well with other herbs. So if there's more heat and irritation, I'll combine Sitopaladi, Talisadi, or Sitopaladi with licorice root. Licorice root's great corticosteroid-like effect. It helps to calm inflammation in the bronchioles. Along with these two classical formulas, it can help to decrease the inflammation, constriction, and congestion that are involved in, say, asthmatic bronchitis or even asthma. I have asthma patients that will often benefit from using a combination of either Sitopaladi or Talisadi mixed with licorice. In the old days, I used to use, I say the old days, but, a couple decades ago and even a decade ago, I'd use Shringabhasma deer antler ash, but I don't use that anymore. It's, for one, you can't import it, and I'm not sure how ethical the practices are around harvesting it and such. So, so I don't use Shringabhasma here. And I have found that there are other alternatives in the herbal kingdom to give the support that I would see when adding small amounts of that in. So as far as the overall dynamics, for the properties and indications of Sitopaladi and Talisadi, you can consider them for common cold and flu, COVID, seasonal allergies with phlegm, asthma that's triggered by dust pollens and other airborne allergens. So anytime where there's repeated coughs and colds, if someone has low respiratory immunity, if I'm using these substances, I often don't use them alone, because in acute illness, like let's say with you succumb to a virus, there may be a movement of these doshas through the tissues, through the dhatus, and at times it may be cold and the phlegm may be thin and you're sneezing and drippy nose, and then it might go to thick and there may heat build up and sinusitis, and then there could be infection, fever can wax and wane, and so I like to work dynamically with these formulas. So with either one of them, I might choose to use licorice as an addition, or Mahasudarshan, or if there's a lot of heat, or Calmag, Andrographis, if there's a lot of heat and risk of infection, and decreasing inflammation, decreasing fever. Jwara is fever. Jwarahara it destroys fever. It brings that fever down. A lot of these herbs are antipyretics. In the Western herbal kingdom, we have bone set, we have golden seal, we have other herbs, gentian, we have other herbs that can have antipyretic-like effects. In Ayurveda, we'll use Calmag, Mahasudarshan, maybe Gulwil Sattva, the starchy extract of Guduchi, which is very cooling. So I'll be combining Sitopaladi and Talisadi with these other herbs to meet the needs of the individual. A lot of deep green phlegm, maybe bronchitis or pneumonia. I might choose Vasak along with Tulsi, maybe Kantakati. Pushkar Mula is great. So there's so many different herbs that we can use. Pushkar Mula is known as elecampane in Western herbal medicine. It helps to soothe that spasmodic cough. Antispasmodics, we get into a whole other realm to help calm. Dispersing really warm and aromatic decongestants and expectorants like osha root can be wonderful additions. And we draw on these allies here when we're using a substance like Sitopaladi and Talisadi. Now, if you're just using them by themselves as a tea, they're wonderful. If you want to soothe the throat a little bit and calm and even help to expectorate more, adding really high quality honey to a warm tea of Sitopaladi or Talisadi is fine. Just don't pour boiling hot water over honey. Wait until it's comfortable drinking temperature, stir in a little raw honey, drink it. It's a wonderful anupana or media for these two formulas, and it helps to guide them directly to the realm of this avalambaka kapha, which is the mother of kapha, the mother of that earth water element. And so a little bit of honey, even though it's sweet, it's warm, it's ushna, and it helps with these formulas to help to disperse and break down and liquefy and expectorate. So when we take these substances and use them as medicines, especially along with the herbs, they have that combined intelligence, that synergistic action. Well, anyway, so there's so much more that we can talk about when it comes to Sitopaladi and Talisadi and Bansalochana as an herb in and of itself. But they're delicious. People love the flavor of them. They are wonderful during acute and recovery phases. I think I'll add one last little piece is in the recovery phases when the lungs have really just been beaten up for a while, you know, hammered by whatever and you know we've been dealing with. Once we're on the upswing, that's when I tend to use more of the heavier herbs, more of the nourishing herbs like bala or ashwagandha, you know, herbs that are going to be have a kind of a building action, a more nutritive action after a person's recovered. Now, there are classical formulas that have bala mixed with dashmula in quath form, like in decoction pills and decoctions. And though bala can be used, it has one of the three, I believe, ephedra alkaloids. It's not going to have the same bronchial dilating effect as ma huang, which is Chinese ephedra, not even by a long shot. But bala is actually more calming and it won't give you the jitters like ma huang can for some people, or it's kind of stimulating. Sometimes it can provoke a little headache unless it's combined very well in a Chinese medicine style. Bala is a lot gentler that way, and it is very restorative to the lungs. I know nowadays ashwagandha has become kind of popular, kind of for its like immune supportive properties, but in at least how I use ashwagandha, I don't use it during those acute phases. I use it during recovery phases, building back up, giving that nourishment, that overall, you know, nourishment that's needed to provide that ojas energy to the body, that ability to find stasis and immunity and balance. And so that's a really good formula, good herb to consider post-illness in the recovery phases. And then it can combine with these herbs. I think that's about it. If you haven't tried these formulas before, I'd recommend getting a small amount of both Sitopaladi and Talisadi. Explore their ingredients. You can check my book, Ayurvedic Herbology East and West. In the traditional herb section, you'll read more about those two formulas, as well as there's a profile in the Materia Medica section of individual herbs on Bansalochana. Enjoy!